heard of semiglutides? They're the active ingredient in Ozempic, a drug originally made for people with diabetes, but we've now discovered they can help obese people lose vast amounts of weight.
Are in fact a synthetic version of glucagon-like peptide 1.
Semiglutide, also the brand name Ozempic.
So many of you have been asking me my thoughts on weight loss drugs like Ozempic.
You can't just tell me there's a new miracle drug that'll make me not fat anymore and then say fucking never mind.
Insurance companies only cover the medication for diabetes, not for weight loss. So if you can't afford them, you're just kind of out of luck.
Oh no!
Really just jazzing up the fact that everybody's taking Ozempic.
A new weight loss drug, one that's been described as a game
Patients
changer.
with obesity lost up to 17.5%.
The drug works by mimicking a naturally occurring hormone that's released from...
One hot topic everyone in Hollywood still seems to be talking about is Ozempic.
Obesity is a biological condition.
Are these new drugs a silver bullet for weight loss?
Most lucrative drug ever made.
I think Ozempic is just the way they put it in the pen, but I got it in its peptide form. And everyone's talking about...
Everybody's talking about Ozempic. And so are we. My summary on Ozempic semiglutide. Hey everyone, it's Anthony Filoni here, your head coach at Adapted Physiques. I hope you're ready to dive into another exclusive. Today we're covering a hot topic that's been making waves in the health and fitness community. Ozempic, also known as semiglutide. This is a new class of weight loss drugs and it has gotten everybody talking. And I'm here to break down everything you need to know about it. The good, the bad, and my personal take on it. So let's get started. What is Ozempic? We've seen weight loss drugs come and go, many focusing on increasing metabolism or energy expenditure, often with mixed results and sometimes dangerous side effects. Remember DMP? Scary stuff, right? But that'll be on another video. But let's talk about Ozempic, a GLP-1 mimetic. It's different. Instead of revving up your metabolism, it focuses on appetite suppression. GLP-1 stands for glucagon-like peptide 1, a gut hormone that slows gastric emptying, increases insulin secretion, and reduces hunger by acting on the brain and inhibiting hunger hormones like ghrelin. How does Ozempic work? You might wonder why not just give GLP-1 directly. Well, GLP-1 has a very short half-life and gets degraded very quickly. That's where semiglutide comes in. It's designed to last longer in the bloodstream by modifying the protein sequence to bind better to albumin and resist degradation. There are both subcutaneous injectable forms and oral forms available, though the oral form requires a higher dose due to its lower bioavailability, which is why drugs like Ozempic and Wegovy use the injectable peptide version. Here's some key research studies done on semiglutide. Let's dive into the research to understand how effective semaglutide really is. One of the first studies I looked at was Step 1 study by the Journal of Endocrine Society in 2021. Their findings from participants that they experienced substantial weight loss with approximately 39% of loss being lean mass, including muscle. This study highlighted the importance of combining semaglutide with resistance training to preserve muscle mass. Another study was the Diabetologia study in 2020. The findings was among 88 volunteers with type 2 diabetes using semaglutide for 1 year, there was an average weight loss of 12.5 pounds, comprising of 7.5 pounds of fat mass and 5 pounds of lean mass. This shows that semaglutide can effectively reduce fat while highlighting the need to address lean mass loss. Another study was the Diabetes Care study in 2022. This is a higher dose study. 95 participants without diabetes lost an average of 30 pounds, with 18 pounds being from fat and 12 pounds being from lean mass. This significant lean mass loss underscores the need for comprehensive fitness plans alongside semaglutide use. Another study was the 1493 Pub study for diabetes. Findings: over 26 weeks, obese and diabetic patients lost an average of 6 kilograms of fat and 2.6 kilograms of lean mass. As you can see in most of these studies, you're losing a lot of fat mass, but you're also losing a ton of muscle mass. So let's talk about the benefits of Ozempic. Effective weight loss. Clinical trials have shown substantial weight loss, averaging around 15% of body weight. It's like the results of gastric bypass surgery without the surgery. 2. Improved metabolic health. It not only helps with weight loss, but it also improves markers like HbA1c and lowers blood glucose levels. For example, the Step 1 study demonstrated improved metabolic health across participants. 3. Appetite suppression. By mimicking GLP-1, it helps you feel fuller and reduces your desire to eat. 4. Non-surgical option. It's a great alternative to weight loss surgeries, with fewer risks and no recovery time. 5. Cardiovascular benefits. It can reduce the risk of heart attacks and strokes in people with obesity and a history of cardiovascular disease, as shown in various studies, including the Diabetes Care Study. Drawbacks of Ozempic. It's not all sunshine and rainbows. Here are some drawbacks from Ozempic semaglutide. Side effects include, first things first, side effects. Common side effects include nausea, vomiting, diarrhea, abdominal pain. Most of these are GI related and usually resolve within 2 weeks. 2. Lean mass loss. Significant weight loss can include lean mass, which might lower your basal metabolic rate. Studies like the 1493 pub study highlight this concern. 3. Costs and accessibility. It's often expensive and not covered by insurance unless you're a type 2 diabetic. 4. Long-term safety. The long-term effects are not fully understood, requiring more research. Some concerns about thyroid cancer and other cancers have been raised, but there's no solid human evidence to support this yet. Usage. And remember, I'm not a doctor, so talk to yours first. Semaglutide is a prescription medication primarily used for the management of type 2 diabetes and obesity. It is typically administered as a subcutaneous injection under the skin and is available in different formulations and doses. Depending on the specific indication, here's how semaglutide is commonly used. For type 2 diabetes, dosage. The dosage of semaglutide for type 2 diabetes management may vary depending on specific product and individual patient needs. Common dosages include 0.5 milligrams and 1 milligram once a week. Your healthcare provider will determine the appropriate dose for you. 2. Administration. Semaglutide is administered as a subcutaneous injection, usually in the abdomen or thigh. The injection site can vary, but it is very important to follow the instructions by your healthcare provider or the medical's package insert. 3. Frequency. Semaglutide for diabetes is typically administered once a week on the same day each week. It can be given with or without food, and the time of day can vary based on individual preference. 4. Monitoring. Your healthcare provider will monitor your blood sugar levels regularly to assess the effectiveness of semaglutide and will make any necessary adjustments to your treatment plan. Now let's move on to obesity. For obesity. 1. Dosage. For obesity management, semaglutide is available in higher doses than for diabetes. The most common dosage is 2.4 milligrams once weekly, but your healthcare provider will determine the appropriate dose for you and your weight loss goals. Personally, I have seen 2 milligrams being the higher amount of dosage for obesity. 2. Administration. Semaglutide for obesity is administered as a subcutaneous injection. The injection site can vary, and it should be administered on the same day each week. 3. Frequency. Semaglutide for obesity is typically administered once a week as a long-acting formulation designed to help with appetite control and weight loss. 4. Monitoring. Regular monitoring of weight, dietary habits, overall health is essential when using semaglutide for obesity management. Your healthcare provider will track progress and provide guidance on diet and lifestyle changes. Ozempic dosing schedule. Typically, you take 0.25 milligrams for the first 4 weeks to get your body used to the medication. Sometimes you would then increase to 0.5 milligrams for at least 4 weeks. Many people stay at this dose long term if their blood sugar is controlled. The dose will increase to 1 milligram if additional blood sugar control is needed. 2 milligrams is the max dose prescribed if additional blood sugar control is needed, although I have heard 2.4 milligrams has been prescribed as well. General guidelines. Always follow the instructions provided by your healthcare provider or the medication's package insert regarding dosage, administration techniques, and schedule. Semaglutide is not to be mixed with other medications in the same syringe. Store the medication in accordance with the manufacturer's recommendations, usually in a refrigerator. Carry out proper injection technique and maintain a sterile environment to minimize the risk of infection. Continue to follow a healthy diet and exercise regimen as recommended by your physician. Report any unusual symptoms or side effects to your healthcare provider promptly. Semaglutide should only be used under the guidance of a healthcare professional who will be able to assess your specific health condition, provide personalized dosing recommendations, and monitor your progress. If you have any questions or concerns about the use of semaglutide, consult with your healthcare provider for clarification and guidance. My personal opinion. So what's my take on Ozempic? If you're considering using GLP-1 peptides like Ozempic, I highly recommend prioritizing resistance training and protein intake. This helps mitigate the lean muscle mass loss and ensure to incorporate nutrient-dense foods into your diet to get the most out of the smallest dose possible and try to avoid any side effects. A supplementation protocol should be considered to aid you in mitigating side effects, optimizing health in lower calorie diets, and to aid in retaining muscle and bone density. Remember, these drugs can help build healthier habits, but maintaining those habits is crucial once you stop the medication. In conclusion, Ozempic is a promising option for those struggling with obesity, offering significant weight loss and health benefits. However, it's important to use it wisely and alongside lifestyle changes. Consult with your healthcare practitioner to see if it's right for you. And remember, fitness and health are journeys, not destinations. There is no miracle drug that is going to do all the work for you, but Ozempic can help out. Thanks for tuning in. Don't forget to like, comment, and subscribe for more. And remember, you can find my full breakdown on Ozempic in the Adapt Now app by Adapted Physiques. I'll see you guys on the next one.